Good morning, everyone. Thank you so much for joining me. I'm Becky McGregor, your APS Employee Wellness Coordinator, and we are joined today with Carla Sassano from Cigna. Today, we're doing Your Benefits Connected, and Cigna is going to give us a presentation on the special benefits you have for you and your family under the Cigna Health Plan. We also have Valerie Atencia, our Senior Benefits Director, on the call, as well as Ann Johnson and Samantha Smith. We are going to go through this presentation. And we want to just give you a couple of reminders to please be sure to put your phones and computers on mute. Turn off your camera, but as we go through and we get to the Q&A at the end of the presentation, you certainly can put your camera back on. We do like to talk to you. You can put your questions in the chat box, and we kind of work this two ways. If you want to put your questions in the chat box as we go so you don't forget them, we can try to answer them as we go, but also we'll pull them out for Carla to answer anything really specific to the Cigna plan. This session is being recorded, and it will be available for on-demand viewing on the APS Employee Wellness channel. So again, thank you all for joining us bright and early on this Wednesday morning. I am going to kick this over to Carla.
Hi, thank you so much, Becky, and thank you everyone for joining me today to review your Cigna plan benefits. You can go ahead and switch. Becky's driving, so we're gonna, great. Okay, so let's dive into the Cigna plan options. With Cigna, you have the Open Access Plus network. So with the Open Access Plus or PPO, you have access to a very large network of healthcare professionals and facilities. It is not required, but it is recommended that you get a primary care physician really to help be an advocate for your personal care. You do not need a referral to see a specialist. And you can choose doctors or facilities that are not part of the open access or the PPO network, but just know that your costs may be higher. And with Cigna, you do have predictable out-of-pocket costs. Go ahead and go to the next slide. So first thing, it's super important that you understand specific terms to your plan. So we're going to quickly review them. Of course, if you have questions, don't hesitate to put them in the chat. But a deductible. So this is the amount that you're going to pay each year out of pocket before your plan begins to pay for covered healthcare costs. Your copay. This is that preset amount, and we're going to go over in detail a little bit about your plan copay. But this is a preset amount that you pay, and then for care services, and then your plan will pay the rest. Coinsurance is your share of the cost of the covered services. The plan pays the rest. Your out-of-pocket maximum. So this is the absolute maximum amount you're going to pay in the plan year. Once that's paid, your plan covers 100%. So in-network and out-of-network, these are important terms with this plan. So in-network, these are facilities and providers that have contract with Cigna to deliver services at that contracted discount. You will always pay a lower amount for these services. The out-of-network, these are facilities or providers that don't participate in the plan's network. They're covered, but you're going to pay more cost. Next slide, please. Okay, so let's review some of those benefits. So it's kind of small, but I'm just going to highlight. So for the calendar year deductible, in-network, the OAP or the PPO is for an individual, you have $1,000, an employee plus one, it's $2,000, and a family. So that's you, your child, your husband, and 6 children or 10 children. That's your family. Your deductible is $2,500. And I'm going to stay in network, but if you look on the right-hand side, you'll notice that the individual, the employee plus one, and the family deductible is much, much higher. So that's why it's super important to stay in network. Your out-of-pocket max for an individual is $5,000. As an employee plus one is $10,000, family plus one is $12,500. Quickly, I'll review, and I'm not going to go over each line item because you're going to have this available to you later, but I do want to talk about those copays. So for physician services, for that primary care physician, when you go to the office, you will have that $30 copay. Then the plan pays the rest. So if the service itself is $150, you're just paying that $30 copay. Specialists, those are $60 copays. So a specialist, that's a cardiologist, radiologist, those IST doctors, if you will. Your preventive care, this is where it's super important. I'm going to go over it a little bit later, but the plan pays 100%. As you go down, you'll see the different copays and where the plan kicks in. Something super, super important, that very last line item, behavioral health coverages. Your employer, Albuquerque Public Schools, cover these in-network services at 100%. That's zero out of pocket to you. If you go out of network, however, the plan still covers, but only at 50%. Okay, next slide, please. Really important too that you understand the claim process. So once you visit that physician or medical facility, you're going to provide them your Cigna ID card. You're going to pay that copay if one applies that we talked about earlier. Your doctor or the facility will send the claim to us at Cigna. Cigna will send you this explanation of benefits. Super important that you review your explanation of benefit always prior to paying any medical bills, just to ensure there are correct charges and that all the discounts have applied. Next, please. All right, as you can see here, this is the United States of America. All the red is what Cigna's OEP or PPO plan coverage. So you can see that Cigna truly is nationwide. Next slide, please. As a Cigna member, you have access to all things Cigna on your My Cigna account. This is either on the web or the My Cigna app. This is truly your one-stop shop for all assessment tools, plan management, medical updates, and so much more. So you can find your doctors and medical services, view your ID card information, review all your coverage or what your plan specifically covers, manage and track all your claims, compare your costs and quality information for doctors and hospitals. You can access a variety of health and wellness tools and resources. You can sign up to receive alerts when your new plan documents arrive, and that includes that explanation of benefit. You can track your account balances and deductibles, and you can see here that's highlighted in red. Really important to opt into emails from your medical benefits carrier. This way that you won't be at risk for missing important information about your plans, any new plan programs or services. So at the end, I'm going to kind of quickly review this My Cigna portal. Next slide. With MD Live Virtual Care, you and all your eligible family members can easily connect with board-certified doctors, pediatricians, nurse practitioners, licensed therapists, or psychiatrists without even leaving your home, your car, your work, or wherever you may be. And this is through MD Live Virtual Care. So you can also complete your preventive care exam at no cost, including your biometric screenings. Additionally, you can establish a primary care provider and see that same provider. With virtual urgent care, this is that 24-hour, 7 days a week for a bunch of medical conditions. I'm going to review those in a second. And you can also receive some prescribed medications if it's deemed necessary. Through virtual behavioral care, you can connect with a licensed counselor or psychiatrist that they treat, they diagnose, they prescribe medications for non-emergency behavioral mental health conditions such as depression, addiction, and life changes. With virtual dermatology, yes, that's a thing. You can meet with a board-certified dermatologist for a variety of skin, hair, nail condition, and then you receive a customized treatment plan within typically a 24-hour time period. Next slide, please. So right here, you can see a list of conditions to utilize that virtual medical care. So that includes allergies, cold and flu, which we're about to enter, insect bites, sinus infection, sore throats. Next slide. And then here is where you see some of the behavioral health conditions. That includes addiction, grief, depression, stress, even eating issues. And additionally, just for your knowledge, you have access to other virtual behavioral services such as Talkspace, Maru Health, and Ginger. And again, to view all of these providers, you just need to go to mycigna.com or the MyCigna app. All right. So as a Cigna member, you also have additional behavioral health support. This is Cigna's Total Behavioral Health. So they really help manage those life events. So you do have 3 face-to-face visits with a licensed mental health provider in Cigna's EAP network. And this is important to note, it's for Cigna members only. You get live chats with an employee assistance advocate, unlimited phone consults, legal services, access to financial services. And really cool, you get access to free digital tools and resources like iPrevail. So this is an interactive video lesson. They have one-on-one coaching, trained peer specialists, and then Happify, which I have downloaded myself. It's self-directed activities and science-based games, guided meditations to kind of help you through the day with that resilient and reduce the stress. And again, this is at no cost to you as a Cigna member. Next slide. So on MyCigna, as a member, you have access to our mental health assessment tool. So it's located under the wellness link, which I'll review in a little bit, and it guides you through a brief 5-minute behavioral health assessment. So based on your answers, it's going to direct you to the best resource for you. It takes all that guesswork out when you're at a time of need. Next slide. So we do want to make certain that we provide you with a variety of programs and services to help keep you healthy. So we're going to review those next. As a Cigna member, you have access to our highest level of support. So this is called Cigna One Guide. This is via the web or your MyCigna app. A One Guide customer service is available live or on the phone or online chat, and it really helps you be more engaged with your personal health care and help you reduce your medical costs, become an informed consumer, which is super important, and give you that personalized support that you need. So during enrollment, they'll answer specific questions about this plan. You have a pre-enrollment line that is available on your site, but if you have any questions about the Cigna plan, they'll help you with that and identify if this best meets your needs. Of course, find if any of your doctors are in network at all or just basic plans. After the enrollment, you have access to a fully integrated search tool. It enables you to find local and network doctors, facilities, estimate service procedure costs. You can build a health team for easy access to names, addresses, and phone numbers. They also help you with concerns, including understanding the benefits of the plan, understanding your bills, getting your treatment, managing conditions, finding facilities that you need. And then you also can view in your messages, which are called next best actions. They're relevant basically to you and your personal health, and they'll help you guide you through your healthcare situations. Next slide, please. Of course, anytime you need us, so you have a toll-free number on your ID card for customer assistance 24 hours a day, 7 days a week, 365 days a year, and language translation is also available. Next slide. With Cigna's 24-hour health information line, you can speak to a nurse that's there to provide you information, help you get answers about your health. It's printed on the back of your ID card. Of course, if it's not handy, you go to your app or mycigna.com. You can also get information to help you decide when you should get treatment, if you have any general health or specific healthcare concerns. And there's also hundreds and hundreds of podcasts that help you stay informed about your health. And these are all available on the Cigna portal. Next slide. So this is what I was talking about. Super important to get your preventive care. That's why this plan includes coverage for preventive care services at no cost to you when you receive them from a doctor that's in the Cigna's network. This means no money taken from your account, no out-of-pocket cost to you. So some of the services that are covered, and this is not an exclusive list, but are screenings for your blood pressure, your cholesterol and diabetes, colon and rectal cancer screenings, breast cancer screenings, mammograms, pap tests, and PSA blood tests. And just remember when you get that preventive care that it helps you avoid those future chronic conditions, helps you continue to lead a healthy life. So it's really important that you always put your health first. When you're diagnosed with a chronic condition, of course, it can be super frightening, very confusing. So Cigna's chronic condition program includes coaching for several chronic conditions, including those that you see here on the screen. You'll get connected with a coach to help you cope, help you improve your health, create a strategy together, identify and overcome barriers, and develop goals, and even help when there's hospital stays and recovery. Next slide. So available at no cost to Cigna members is the Healthy Babies program. This supports the expectant mother in managing the pregnancy, monitoring it weekly, prepare for labor and delivery, and care when the baby arrives. It includes assistance with topics such as prenatal care, exercise, stress, depression. You have access to a 24-hour maternity specialist, access to our Healthy Pregnancies app, personalized support from a case manager should hospitalization occur, or if the baby ends up in NICU. Next slide. So if weight, tobacco, stress, any of that is affecting your health or your ability to live an active life, it's obviously time to make changes. So a health coach, as part of Cigna's life management program, can provide you with personalized support to help you learn and manage your weight using a non-diet approach, develop a personal plan to become and remain tobacco-free, understand the sources of your stress, learn to use coping techniques to better manage both on and off the job. You can do this online or telephonic or both, whatever best fits your needs. Next slide. So the health assessment, this is located on MyCigna or the MyCigna app. I really like it. It helps create a personalized health report. You get to view your score right on your Cigna homepage. It includes information, recommendations, and connections to health improvement opportunities for you. And based on your responses, you may be invited to do an online coaching program, or even we have apps and activities, which you can track your goals, connecting your wearable devices. And then you can also share these results with your physician to work on a wellness plan together. Next slide. We definitely want you to afford getting and staying healthy, so you get discounts through our Healthy Rewards program. This includes nutritional meal service deliveries, fitness and gym memberships, fitness wearable devices like a Fitbit, vision care, LASIK surgery, hearing aids, that alternative medicine, so acupuncture, massage, yoga products, daily burn, virtual workouts. Next slide. So this is our Healthy Rewards program, as I mentioned on the slide, called Active and Fit. You have access to over 11,000 fitness centers, over 5,000 premium exercise studios. Fitness center memberships are $25. And just to note, I'll send Becky a flyer, but they're waiving the fee, enrollment fee from October through December. Otherwise, it's $25 a month. Some gyms that you see listed here are included. And again, they're waiving that enrollment fee October 1st through December 31st. Next slide. Then you also have access to daily burn online virtual workouts. I think a lot of us have gone virtual. The first month, you can try it absolutely free. After that, the membership is a super small fee of $14.95 a month. Next slide. So not being on the Cigna plan, if you want to find whether or not your provider is in our network, you'll just go to Cigna.com and then you'll go to find providers. Just make sure that you note that you're being insured by your employer and follow the prompts after that. It'll show the OAP/PPO plan. You can choose that and then start looking for doctors and facilities. Next slide. And there you go, employer and school, and then you go from there. Put in your address or your zip code. And then now, once you become a Cigna member, you're going to register for MyCigna. Next slide. So this is really a personalized dashboard. And what's really cool about this too, everything's located on the home page, easy to access. And as you can see there, the little talk to chat. If you have any questions, and if you're like me and don't like being on the phone, hit click to chat. They're available and they'll answer your questions on demand. Next slide. And then this shows you here all your medical coverage. So under that coverage tab, if you have any questions about what services can I can I get through the Cigna plan? Once you're on, you just go to coverage and it lists them all, which is really great. Next slide. And then this is just once you're on there navigating, that find care, super important. There's hyperlinks, as you can see, to view coverage. That wellness link, super great because it has tons of resources for you. And then as you can see, if you lose your ID card, you just click there and view it. It's also available on the app as well. Next slide. So here's another thing that you can do. So we kind of went through finding a provider not on the plan. On the plan, you may want to see like how much is it going to cost for an MRI. So you can plug that in just by clicking reason for a visit. MRI, it's going to give you comparable costs and going to tell you where the lowest cost is. As a Cigna member, obviously you're not in Illinois, but it's going to automatically default to where you live. So you'll see you'll see Albuquerque, for example. Next slide. And then here, once you look for a provider, it's going to show the average cost for a visit. It's going to show if they're accepting new patients, and it'll give you a rating, which is great. And then it provides a map so you can see where they're located in correlation to where you're at. Next slide. Here's what's great, the wellness tab. So once you click that link, it gives you a variety of topics. So if you're interested in sleep, for example, it's going to give you everything related to sleep, including those healthy rewards discounts that I talked about, exercise, those Fitbit discounts, things that you can do, podcasts. It's great. Next slide. Here's those healthy rewards discounts. So under each of those topics, as I mentioned, it'll say, here's what's related to exercise. Here's your Fitbit discounts, for example. Here's your meal discounts, for example. But you can hit all healthy rewards and it's going to pop them all up. Once you click on a healthy reward, so let's say you're interested in Active and Fit, it's going to take you to the Active and Fit site. Next slide. That's it. It brought me to questions and answers. So almost exactly 20 minutes, I think.
Woo! That was great.
A lot.
Lots of awesome information. We're going to ask now that you put questions in chat. I have a question for you, Carla. Under the fitness plan, the $25 a month, is that just for one gym or is that for any of the gyms, any and all of the gyms in that network?
That is it. Yep, you've got that right, Becky. So you can try 5 gyms at once if you want.
For just that one $25 fee?
With the $25 fee. Yep. Just know though, and we just added those premium gym discounts. So those vary, but it gives you cost transparency. So it's going to let you know how much that is a month. So those are those really bougie fit premium gyms, but it tells you how much it is. I haven't seen anything above $50.
Okay. Just wanted to know if that was an all-inclusive type thing. So great.
Yep. Good question.
Yeah. Does anybody have any questions for Carla? It was very thorough. Do we have any questions that anybody wants to pop in? Because if not, I will be going forward through some reminders. Okay. So I will give you closing reminders just to let you know that we are having these information sessions all week, medical, dental, vision, your ASI flex plan, and as well as Express Scripts pharmacy provider. That's all this week. And you can find obviously all that information on our wellness event calendar, which you know about because you've attended this session. Open enrollment is completely online, and we're going to walk you through that Winocular workspace system next Tuesday, October 4th at 3:30. So if you have any questions or just want to kind of see the form and just get more information on how that might help you, join us Tuesday. Please come to our APS Employee Wellness Fair, Thursday, October 6th from 7:30 to 3:30 at Berna Facio. We're going to have online assistance with online open enrollment, but also all of our medical and non-medical benefit providers are going to be there, Carla included. So if you have some deeper questions, you want to ask more just personal questions and just kind of have a little bit more one-on-one, face-to-face interaction, please come and get all your questions answered. In addition to that, though, we are going to have a blood donor drive. We have the Blue Cross Blue Shield Caravan for biometric screens, vision screens. We're going to have vaccinations at the event, as well as a basic CPR certification, other preventive health screens, and we have a host of community businesses joining us, mental health resources, local gyms, other local businesses in the well-being space. And so we really encourage you to join us next week for that wellness fair. Please put your name in the chat box because we are doing a raffle for prizes. Cigna has graciously donated some really cool prizes for our employees. So put your name in that chat box and we'll be doing a raffle drawing. We are all about your benefits connected because we know the more you know about your resources, the better able you are to take care of your health holistically. So please connect with APS Benefits and Wellness via Facebook, Instagram, Twitter, and YouTube, and the APS Perspective, which goes out every other week. We are very consistent about putting information in there for you. And of course, we have the Employee Wellness Google event calendar, and then aps.edu/wellness, where we keep everything updated for you in regards to your benefits and wellness resources. And open enrollment is online at www.aps.edu, open/enrollment. So please, if you have any questions and want to look at anything more, it's all there available for you. Thank you so much for attending this presentation. We appreciate your participation and your Benefits Connected. If you have more questions, we've got some additional information there for you. I will stop recording, and then if anybody wants to stay on the line, you certainly can.
Becky, people are